People generally view a dental implant as something that is used to replace a missing tooth or missing teeth. There's actually two components to the implant. So there's the part that goes into the bone, which looks a bit like a metal screw, and there's the part that screws in or attaches to the implant, which looks like a tooth, really. Implants are usually made of type 4 titanium. Some are made of zirconia, but the majority of implants are made of titanium. Part of the implant that goes into the jawbone looks very much like a screw. It's got threads. They may be different sizes, different diameters, different lengths, slightly different shapes, and these are used for different scenarios. Implants are all designed to promote stability in the short term and bone integration in the long term. When we're considering placing implants, there's several phases. Initially, of course, we start off with an assessment. We're checking for feasibility, any underlying issues that we may need to deal with, any underlying gum disease. There may be a tooth that needs to be removed first. It's an assessment, and we have to check what the procedure will be. There'll be a clinical aspect to the assessment. There'll be a radiographic aspect to the assessment. There'll be a planning phase, a consultation, and then we move on to the surgical phase, which is actually placing the implant. Placing the implant itself can be very straightforward. The procedure is done under local anaesthetic, so we'll just be numbing up the area that we're working on. There'll be a small incision in the gum. We'll make a little hole in the bone and we'll thread in the implant. That in itself can take 30 to 40 minutes, but the whole appointment will take somewhat longer. We're going to place some sutures, then that phase of the treatment will be over. We'll have a review 2 to 3 weeks later, and it really depends on the circumstance and what we're planning. So there may not be another appointment for 2-3 months, or there may be several other stages where we're taking measurements or providing temporary teeth at that time. The procedure itself, it's not a comfortable procedure. Obviously, someone's working in your mouth in a small space, but it won't be painful. And if it is, you should let the dentist know. They would stop and give you more anaesthetic. But the recovery varies depending on the procedure and the individual, of course. It's usually fairly painless, so we have reports of almost no pain at all the next day, to a few days of discomfort, which are easily managed with painkillers. There can be an occasion where there'll be some swelling, some bruising. This may be, again, dependent on the individual or the medication they're taking. But generally, it's very controlled, and after a few days, most of the swelling and bruising will be gone. The implants can be maintained over a long period of time, so 10, 20, 30 years plus. The implant crowns last on average 10 to 15 years.